Welcome, everyone, to today's live trivia show, where sharp minds and sharper eyes take the spotlight. Get ready to dive into the fascinating world of ophthalmology. From rare ocular diseases to diagnostic signs, surgical procedures, and neuro-ophthalmologic conditions, we're covering it all. Whether you're an eye care expert or just curious, this quiz will challenge and enlighten you. Here's how it works. You'll face 25 questions, each with 4 answer options. Only one is correct. The faster you answer, the more points you earn. To respond, simply comment the number of the correct option or type the full answer. Did you know keratoconus can cause progressive thinning of the cornea, leading to distorted vision? That's just a glimpse of what's ahead. Remember, 25 questions, 4 options, 1 correct answer. Speed counts, comment the number or full answer. Here comes question 1, ready your minds and your keyboards. A 32-year-old man presents with recurrent unilateral decreased vision and halos around lights. IOP is 48 in the right eye, mild anterior chamber cells, open angle on gonioscopy. No posterior synechia, and corneal edema. What's the most likely diagnosis? 1. Viral keratouveitis. 2. Posner-Schlossman syndrome. 3. Fuchs heterochromic iridocyclitis. 4. Acute angle closure glaucoma. Comment the number or type the full answer. Speed and accuracy both matter here. Take a moment, think it through. Those clinical clues are key to cracking this one. Posner-Schlossman typically affects young adults with recurrent high IOP episodes. Perfect score. Everyone nailed it. Shout out, Ahmed Nasser, Radwa Adel, Ahmed Adel, Mr. Native. On to question 2, let's keep the momentum going strong. Which of the following is the most appropriate initial management for the previous case? 1. Systemic corticosteroids only. 2. Oral acetazolamide plus topical beta blocker plus topical steroid. 3. Observation only, self-limiting. 4. Immediate peripheral laser iridotomy. Think carefully, initial steps matter most in acute presentations like this one. Submit your answers now, folks. Posner-Schlossman often presents with mild eye pain and blurred vision. "44 got it exactly right. Shout out, Maoya Salim, Ahmed Nasser, Ahmed Adel, Mr. Native. Here comes question 3, let's test your infectious disease knowledge. Which infectious association has been most discussed in Posner-Schlossman syndrome? 1. Treponema pallidum. 2. Toxoplasma gondii. 3. Epstein-Barr virus. 4. Cytomegalovirus. Some pathogens love the spotlight. Pick the one most talked about here. Posner-Schlossman syndrome often affects one eye and recurs unpredictably. "34 nailed it, great job. Shout out, Mr. Native, Huggy Radwa Adel, Ribbon AIA Ribbon. Time for question 4. I see you thinking already. The most common source of vitreous hemorrhage in sickle cell retinopathy is 1. Subretinal hemorrhage. 2. Retinal artery macroaneurysm. 3. Peripheral neovascularization, CFAN. 4. Central retinal vein occlusion. Retinal clues are tricky. Trust your instincts and lock in your answer now. CFAN neovascularization resembles ocean coral, delicate, branching, and sight-threatening if untreated. 50 answered right. Impressive retina knowledge. Shout out, Ahmed Nasser, Reem, Ahmed Zayedi, Sarah Samir. Here comes question 5. Let's light up your retinal knowledge. The dark choroid sign seen on fluorescein angiography is most characteristic of 1. Stargardt disease. 2. Retinitis pigmentosa. 3. Central serous chorioretinopathy. 4. Best dystrophy. Think carefully, this sign is a key diagnostic clue. Lock in your answers now. Dark choroid appears due to blocked fluorescence from lipofuscin buildup. Fascinating, right? "51 nailed it, stellar retinal recall. Bravo Ahmed, Mr. Native, Reem." Time for question 6. Let's keep the momentum going strong. Which of the following is the most common ocular manifestation of leukemia? 1. Vitreous hemorrhage. 2. Retinal hemorrhages. 3. Optic disc swelling. 4. Choroidal infiltration. Eyes reveal a lot. Choose wisely and lock in your answers now. Leukemia can affect the retina early. Watch for subtle hemorrhages during exams. Retinal hemorrhages, 36 answered correctly. Shout out Hoda, Asma, Maoya, Mr. Native. Here comes question 7. Let's test your retinal knowledge. The copper wiring appearance in hypertensive retinopathy is due to 1. Thickening of the arterial wall with partial light reflex. 2. Retinal pigment epithelial atrophy. 3. Hyalinization of veins. 4. Deposition of lipids in vessel walls. Eyes under pressure show fascinating signs. Submit your answers now, retinal detectives. Copper wiring reflects increased light from thickened retinal arteries, classic hypertensive sign. Correct answer, arterial wall thickening, light reflex. 46 got it right, great job. Shout out Ahmed, Mr. Native, Ahmad, Arwa. Question 8 coming in. Let's keep those brains sharp. Right-angled venules are most characteristic of 1. Parafoveal, macular, telangiectasia type 2. 2. Hypertensive retinopathy. 3. Diabetic macular edema. 4. Coats disease. Tiny vessels, big clues. Lock in your answers now, retinal sleuths. Right-angled visuals often point toward specific retinal vascular disorders. Stay sharp. Correct answer, parafoveal telangiectasia type 2. 50 of 55 answered correctly. Impressive. Shout out Ahmed, Native, Hoda, Ribbon AIA Ribbon. Question 9. Let's test your syndrome spotting skills. A child presents with epibulbar dermoids, preauricular skin tags, and vertebral anomalies. Which syndrome is most likely? 1. Treacher-Collins syndrome. 2. Naegger syndrome. 3. Goldenhar syndrome. 4. Charge syndrome. Think craniofacial clues, locking your answer, future diagnosis detectives. Goldenhar syndrome is also called oculoauriculovertebral spectrum, quite a mouthful. Correct answer, Goldenhar syndrome. Well done. 52 of 58 got it. Bravo Iman, Huggy Wuggy, Ribbon AIA Ribbon, Dr. Shima. Time for question 10. Let's dive into ocular trauma. According to Roper Hall classification, which grade is defined by greater than 50% limbal ischemia after chemical injury? 1. Grade 4. 2. Grade 3. 3. Grade 2. 4. Grade 1. Eyes on the prize. Choose wisely, ophthalmology champs. Limbal ischemia severity guides treatment after chemical eye injuries. Knowledge saves vision. Correct answer, grade 4, tough one. Only 2 of 52 succeeded. Well done Ahmed, Asma, impressive knowledge. Here comes question 11, get ready, cornea connoisseurs. In bullous keratopathy, painful recurrent erosions are caused by 1. Inflammatory cytokines from anterior chamber. 2. Epithelial bully rupture. 3. Corneal neovascularization. 4. Breakdown of Descemet's membrane. Eyes wide open, tap your best yes now. Bullous keratopathy often follows cataract surgery. Endothelial damage plays a major role. Correct answer, epithelial bully rupture. 49 of 57 answered correctly. Great job Mr. Native, Ahmed, Mohammed, Iman. Question 12 coming in, let's treat those eyes right. The treatment of choice for symptomatic band keratopathy involving calcium hydroxyapatite deposition in Bowman's layer is 1. Penetrating keratoplasty. 2. Mitomycin C application. 3. EDTA chelation with epithelial debridement. 4. Diamond burr polishing alone. Think carefully, calcium's tricky, but you've got this. Band keratopathy often appears in chronic uveitis or hypercalcemia-related conditions. Correct answer, edentaculation with debridement. 51 of 60 answered correctly. Well done, Ahmed, Native, Iman, Ribbon AIA Ribbon. Question 13, let's keep the momentum going strong. Shield ulcer is classically associated with which condition? 1. Acanthamoeba keratitis. 2. VKC. 3. Morin's ulcer. 4. Herpes simplex keratitis. Eyes on the prize, choose wisely, future ophthalmology legends. Shield ulcers often form due to mechanical trauma from giant papillae in VKC. Correct answer is VKC, well done. 53 of 55 answered correctly. Shout out, Ahmed, Ribbon AIA Ribbon, Native, Miriam. Question 14, let's test your clinical instincts. Post-PKP, pupil stays dilated and irregular. What's the most likely diagnosis here? 1. Ehrts-Zevalia syndrome. 2. Traumatic mydriasis. 3. Pharmacologic dilation. 4. Eades tonic pupil. Think fast, this one separates the sharp from the sharper. Ehrts-Zevalia syndrome is linked to postoperative mydriasis after corneal transplant surgery. Correct answer, Ehrts-Zevalia syndrome. Impressive. 50 of 58 answered correctly. Well done, Native, Fadlone, Reem, Ahmed. Question 15, let's lift those lids with knowledge. What sling is used in kids? 1. Supermit suture. 2. Silicone rod. 3. Gore-Tex. 4. Autogenous fasciolata. Think carefully, materials matter in pediatric ptosis surgeries. Fasciolata is often harvested from the patient's own thigh. Correct answer, autogenous fasciolata. Nice! 21 of 53 answered correctly. Shout out Naila, Zayden, Nasser, El-Nokali. Question 16, let's zoom in on eyelid tumors. Which presents like a rodent ulcer? 1. Squamous cell carcinoma. 2. Sebaceous carcinoma. 3. Keratoacanthoma. 4. Basal cell carcinoma. Choose wisely, this one often sneaks in subtly. Basal cell carcinoma rarely metastasizes but can cause local tissue destruction. Correct answer, basal cell carcinoma. Well done. 53 of 58 answered correctly. Shout out Nasser, Native, Adele, Zayden. Question 17. Let's talk intraocular pressure in tricky situations. Which method works best here? 1. Schiet's tonometry. 2. Rebound tonometry, eye care. 3. Perkins handheld applanation. 4. Goldman applanation. Kids squirm, choose wisely, steady hands might not help. Rebound tonometry requires no anesthesia, great for kids and quick checks. Correct answer, rebound tonometry, eye care. Nice! 44 of 56 answered correctly. Shout out Naila, Native, Zayden. Question 18. Glaucoma detectives. Time to test your optic nerve knowledge. Which isn't typical here? 1. Pallor greater than cupping. 2. Nasalization of vessels. 3. Focal notching of rim. 4. Bearing of circumlinear vessels. Eyes don't lie, choose carefully, every detail counts. Glaucoma often progresses silently. Regular eye exams are absolutely essential. Correct answer, pallor greater than cupping. 54 of 60 answered correctly. Shout out, Native, Ibrahim, Nasser. Question 19. Laser precision time, folks. Ready to focus? Which laser treats cyclophotocoagulation best? 1. ND-YAG laser, 1064 nanometers. 2. Excimer laser. 3. Diode laser, 810 nanometers. 4. Argon green laser. Think wavelength and application, lock in your answers now. Diode lasers emit infrared light, ideal for targeting ciliary body tissue precisely. Correct answer, diode laser, 810 nanometers. 47 of 57 answered correctly. Cheers native, Iman, Radwa, Zayden. Question 20. Let's dive into gonioscopy. Which finding signals pigment dispersion, not pseudo-exfoliation? 1. Pseudo-exfoliated flakes on lens. 2. Peripheral anterior synechiae. 3. Patchy trabecular pigment. 4. Homogeneous trabecular pigmentation. Eyes on the angle, submit your answers now, glaucoma detectives. Pigment dispersion often affects young, myopic males more frequently than others. Correct answer, homogeneous trabecular meshwork pigmentation. Only 9 of 50 answered correctly. Well done Fadloon, Medwali, Hamada, Zayati. Question 21. Let's talk ocular myasthenia. What's the first line therapy for treatment? 1. Pyridostigmine. 2. Plasmapheresis. 3. Oral corticosteroids. 4. Intravenous immunoglobulin. Eyes on the prize, lock in your answers now, neuro-ophthalmology ninjas. Myasthenia gravis often worsens with fatigue and improves with rest. Correct answer, pyridostigmine. Well done everyone. 51 of 54 answered correctly. Shout out, Native, Raid, Nasser, El Sayed. Question 22. Time to test your neuro-eye reflexes. Direction of this nystagmus is 1. Upbeat. 2. Right beating. 3. Left beating. 4. Downbeat. Eyes darting? Minds racing? Lock in your answers now, sharp thinkers. Nystagmus direction is named after the fast phase movement. Correct answer, right beating. Well played, everyone. 47 of 54 answered correctly. Shout out, Native, Ibrahim, Shima. Question 23. Neuro-ophthalmology fans, this one's for you. The contralateral eye in Foster Kennedy syndrome typically shows 1. Papilledema. 2. Optic disc pallor. 3. Normal optic disc. 4. Drusen. Think fast, optic nerve detectives, lock in that answer now. Foster-Kennedy syndrome involves optic atrophy and contralateral papilledema, classic compression sign. Correct answer, papilledema. Well done, everyone. 27 of 52 answered correctly. Shout out, Naila, Miriam, Omar, Mohammed, Ahmad. Question 24. Get your striated glasses on, folks. The Bagolini striated glasses test shows 1. Right hypotropia 2. Right hypertropia 3. Left hypertropia 4. Abnormal retinal correspondence. Eyes up, minds sharp, submit your answers now, Vision Detectives. Bagolini glasses assess binocular vision using faint striations, great for subtle alignment issues. Correct answer, right hypertropia. Nicely done. 33 of 45 answered correctly. Omar, Mohammed, Mr. Native, Hoda, Habiba. Final question. Let's finish strong, everyone. Which feature is least likely in monofixation syndrome? 1. Reduced stereoacuity. 2. Peripheral fusion preserved. 3. Large angle strabismus, 10 delta. 4. Central suppression scotoma. Think carefully, this one separates the champions from the rest. Monofixation syndrome often shows small angle strabismus with central suppression scotoma. Correct answer, large angle strabismus. Well done. 43 of 49 answered correctly. Naila, Anas, Ahmed, Sama, great job. "70 players joined, what an amazing game." Top winner, Mahmoud Mustafa Medwali with 23 correct. Congrats Mahmoud Hamada, Mohammed Fadloon, and others. Thanks for playing, see you next trivia night.